It's Lorena Mora-Mowry from Latina Today. We're one day before Thanksgiving, and we're thankful for giving the Dr. Elias Anaissie the opportunity to interview him, especially when we just finished to interview a very inspiring story. So welcome to Latina Today, Doctor.
Glad to be here. Thank you for visiting with us today.
Well, you came here a year ago to create this center for our community. Let's talk about this. Let me say it completely. The George Strike Bone Marrow Transplant Center. Let's talk about that a little bit.
Okay, well, what we wanted to do is to provide to the greater Cincinnati area, our community, but also to several other states, a program that is unique in many ways. One of the ways we believe it is unique is, as you've seen with this patient, we did high-dose chemotherapy and stem cell transplantation, and he did not spend a single day in the hospital. So he was all out, comes in, checks in our center. That's why we're here, open all the time, available. So, and we worked based on our research to minimize the complications of stem cell transplantation. And you've seen with him, not a single day in the hospital, it was sometimes a little mild loss of appetite or whatever, but by and large, he really had a remarkable course.
And before it was just like a long procedure?
Before, usually you put the patient in the hospital and for 21 days. And you put the patient in the hospital, they lose appetite, they lose sleep, they stay in bed all the time, so they lose muscle mass. The anxiety of being away from home, away from familiar things, away from families, friends, pets. Then you give them that gown that opens from the back.
Mm-hmm.
I call it the no dignity gown. So I tell my patients, if they happen to be admitted for a complication, I said, you bring your pajama, and or your clothes, whatever you want. We don't need that gown. That's what I do regularly. The other things that we focus on is involving the patient and the caregiver, typically the family member, in this case it was the wife, fully on board with us. So it's a shared experience. And the reason we do this is, first, patients feel empowered, that they have a say in this. They are following what's going on. They know what to expect. They all get my cell number, phone number, 24/7, 365. And they've called me a couple of times where they were really in very tough situation. And they may have called you or not, but I make sure patients can reach me anytime, throughout the year, throughout the time, whatever.
I was just reading this, and that's what is important today in interview, because something that I read is a teamwork.
It's absolutely teamwork. It is, the team consists of the doctors, the nurses, the nurse educator, the dietitian, and most importantly, the patient and his or her caregiver. That's a team. The advantage of this is, if you invite the patient and the caregiver to be part of this team, and you educate them, you do everything possible so they learn what is this disease, what is the procedure, etc., then they become your eyes and ears 24/7, 365. You don't have to pay them for that, and they're not complaining about working without the pay. This is the best system, right? Who has more at stake in the outcome of any treatment than the patient and his loved one? No one.
Well, and I was just interviewed this patient, and everyone seems happy. The mother, the wife was happy, and it was like just those happiness, like I feel fine, and it makes that feeling.
There was a lot of concerns because he heard a lot about transplant from other people, you know, your mouth will fall, or you have severe diarrhea, you'll have this, you'll have that, you won't be able to function.
And the people
he did
Google
not
too.
experience that at all, as you've seen.
Doctor, so this is a very personalized, it's like a...
Highly personalized.
So is the patient, is the name, is the procedure. Can you just give us an overview, talk us a little bit about the procedure? Just...
The procedure is very simple. Essentially, what you want to do is to kill the cancer cells for the specific blood cancer, to kill it as much as you can without, of course, causing major damage to the patient. So in order to do that, because one of the drugs that is used, the most important one, can cause a very significant effect on the bone marrow, which is where the new blood cells are made. The red cells that can cause anemia, the white cells that can cause infection, and the platelets that can cause bleeding if these are low. So if you do the chemotherapy, it works, but if you don't rescue the patient, the immunity can be down for several weeks, and there's a high risk of death. So what you do is, a day after you give chemotherapy, you go back in and you give them their stem cells that we would have harvested a couple of weeks earlier. So you give, the procedure itself, the stem cell transplant itself is more of a rescue, meaning not allowing the immunity to stay low for a long period of time. And what I found, I've done thousands, 3,000-4,000 of these procedures over the past 17 years. And what I find, the single most important thing is the patient and family engagement and keeping the patient outside the hospital, or I call it normalcy. Keep a sense of normal. If they want to work, I say, please do. Just pace yourself. You know, we work also very hard on giving every patient a specific therapy that is fit for that patient. Not everyone, there's no cookbook approach to this. Every patient is, we look at several characteristics of the patient. We look at who is the patient, emotionally, spiritually, religiously, family, behavioral issues.
To give a holistic approach to the
Correct,
patient.
absolutely critical.
What type of diseases do you treat with bone marrow transplantation, doctor?
Any disease of the blood and bone marrow, like leukemia, lymphoma, multiple myeloma, and a few other diseases. But these are the key 3 diseases that are treated with bone marrow transplantation.
But it seems that you treat, it's like a one roof for the patient.
Correct. What we have done here is to put, instead of sending the patient through different departments in the hospital, we bring the departments to the patient. So we're all under the same roof here. We have the physicians, we have the nurses, the advanced nurse practitioner, the dietitian, the nurse educator, the social worker, the behavioral therapist, the clinic, the financial services, the infusion center where we give the transplant, and if they come the next day and need antibiotics or fluids, everything under one area. We even do the procedure, bone marrow biopsy here, and within 2 to 3 weeks, we will also do, when we do the bone marrow transplant, before that you have to harvest the patient bone marrow. We're going to also do it on the same floor.
This
the patient
unique.
doesn't have, it is unique. And
unique in the United States and the world.
I am not aware of any other centers that has it all on one floor. We have the pharmacy picks up, send the stuff here. We'll have soon the testing, and we're talking soon, January, you've seen a lot of construction here. The testing needed to get the patient with the transplant. Testing of the heart, testing of the lungs, all of this done on the same floor, one place.
And I was just going to ask you to conclude our interview, whether you would like to people knows about this center, and I think you would like to add more.
I would like to say that We work as a team with the patient and the family, and our only focus is the best possible outcome for the patient and the best possible experience for the patient and the family, because it's all about the patient.
Doctor, you really inspire us, and I'm so happy and thankful
Thank
in the
you.
eve of Thanksgiving to give me opportunity, because I know that people will see this interview and say, I want to be there, because it's the human part that makes us.
And I also have my own Thanksgiving. I want to thank the community, and I want to thank UC for giving us the opportunity to offer this to the community and beyond. We have patients from 12 different states. We have patients from overseas coming here specifically to be treated.
Well, doctor, we are always welcome. My website in English or in Espanol, no francés, no French.
My son James speaks fluent because he dated a Cuban American, so he's super fluent in Spanish.
Habla español. Next time.
Hablamos plenty of español.
Well, thank you, doctor.
My
and we
pleasure.
have the wonderful, have a nice Thanksgiving, and thank you so much
Same
for
to you
giving
and
me-
your family.
Thank you.